some people talking about dying is really easy and straightforward. They have a really concrete idea of what's going to happen to them, they don't have any concerns, and talking about death and dying to them is fairly straightforward. But for other people that can be a really profound thing that brings up all kinds of thoughts, and that can be really hard to put into words. Hello, I'm Dr. Ben, I'm a consultant in palliative medicine. I work at Willand Hospice and I've been here for over 15 years. My day-to-day job is working with people who are facing life-limiting illness and the challenges that brings. And also helping those that are important to them with those same challenges and their own. Communication is about developing a connection with someone, and that is as unique and individual as the person that you're talking to. It is about that emotional connection. It's about that ability to be open with that person and to understand what it is that they want from the situation. So when you're communicating, it's not about me and me giving you things. It's about you saying what you want and me trying to put that in a way that you can understand. And you may have the same person going through a very similar illness, diagnosis situation, but their needs from what's communicated are totally different. And so for medical students now, that's very much more a part of what they do. And plus they get lots of opportunity to role play. So practicing those skills in as close to real life as you possibly can get. I tend to try and go into any situation with someone I don't know very much initially trying to understand what they want to know. And one of my first questions to someone is, how much do you want to talk about this? How much do you want to know? What's important to you? And that then sets my own boundaries as to where I go. You know, yeah, personally I'm happy to talk about death and dying. And my family could probably attest to that too. There's kind of no topic too sensitive. And I appreciate that amongst, you know, friends and family. As amongst the people that I see and look after and care for from day to day, their attitudes vary too, you know, so it's just being sensitive. I think it's important that people know there are no boundaries with what I'll talk about. If it's important to you, I'm happy to talk about it, but the key bit is, it's important to you. There are situations where you get that difference of opinion or a difference of an approach, you know, because when we communicate with someone here, it isn't just that patient or that person, it's all those that are important to them as well. And they're going to have different ways of dealing with a situation too. So sometimes you get those different approaches very much coming to the fore in a conversation. And then it's about bringing people together and showing them the common ground. You know, showing them that actually talking about these things or communicating about these things is the important bit. And a willingness to be in the room, to be together, to be present, and to acknowledge that however difficult something is, it's worth trying. But that different people will see it from different angles and helping them to appreciate the other in the process.